Hi everyone, my name is Dareen Marghlani, and today I will be discussing important yet often overlooked aspect of chronic pulmonary aspergillosis and its impact on health-related quality of life. My talk name is CAPSULE study. So just a bit about myself and my research journey. My name is Dareen Marghlani, and I am a registered respiratory therapist. I earned my undergraduate degree in cardiopulmonary science from East Tennessee State University in the US. And then later I pursued my postgraduate degree at Imperial College London, where I met Dr. Anand Shah first. Then my research in chronic pulmonary aspergillosis was recognized with the NHLI Prize for Outstanding Research Achievement in the Master Cardiovascular and Respiratory Healthcare Program. After that, I aim to build on my groundwork in the master to advance my research on CPA, and I pursued a PhD in clinical medicine research. And as Elizabeth said, it's my project supervised by Dr. Anand Shah, who is a consultant respiratory physician. So again, I know we have talked a lot about CPA, and we covered almost the view of CPA. However, I just would like to highlight that in this presentation, I will walk you through the importance of health-related quality of life measures in CPA and the methodology behind developing reliable and robust tool, which is potentially applicable in CPA practice. So CPA is debilitating condition that significantly affect patients beyond their symptoms profile. However, assessing its true burden remains a challenge due to the lack of a disease-specific quality of life tool. The global burden of CPA associated with notable morbidity and mortality, it's been estimated to complicate over 3 million patients. As my colleague in the previous slides has mentioned, that disease prognosis is often based on CT imaging and serological tests, and sometimes it's really difficult to maintain in low-income countries. So why is health-related quality of life important for CPA patients, and why I was interested in this work? So as I mentioned before, during my master's degree, I identified core domain of health-related quality of life in CPA. And from interviewing patients, this mountain symbolized my experience with living experience with a patient with a chronic disease. People would think or would see living with a long-term condition is all about how many pills you take per day, or if you are just not feeling well. However, when we dive inside people's life and we try to understand their experience, we were surprised that there is invisible burdens beyond only the condition and its prognosis. So I was able to conduct a systematic review, which is going to hopefully be published soon. We analyzed the existing tools that was used in assessment of CPA, and we was able to highlight its limitations. We identified the important key domains that patient and healthcare providers as well was trying to capture to manage CPA patients. We found burdens is not only about the disease itself, however, it's about the symptoms, the treatment, the CPA consequences on quality of life in terms of intimacy, occupational, physical, social, also future plans. Also with the coping strategies with CPA, some of the people can cope with it and others find it much more difficult, and the overall health burden. So my PhD is conducted in Imperial College London and is funded by the Ministry of Education in Saudi Arabia. My PhD aim to assess the impact of CPA on health status and well-being by developing a novel disease-specific health-related quality of life called CPA Health Assessment Questionnaire. So why are we doing this research? As I mentioned before, the current tools and symptom scores are generic, lengthy, and complex when it comes to scoring, which poses significant limitation regarding implications in clinical trials or clinical monitoring. So when assessing its content validity and usability in CPA, we didn't find a robust work on that. So a disease-specific health-related quality of life tool is important because it offers us better understanding, which is potentially offers better care and treatment. So how will this tool actually help patients? A disease-specific tool will focus on specific symptoms and specific experience with the condition. It's going to give a doctor a clearer picture of your symptoms and change and health status. It helps monitor your condition over time because it's subjective and easy to use. And then potentially it can assess the treatment efficacy, and most importantly, it can guide and standardize clinical research studies, which reveal robust results. So often people think developing a tool is just by sitting and write quite list of the questions and then it might work and it might not. However, in my PhD, we was eager to develop a tool that is based on a robust approach. So my study has been going through 3 phases. The first phase, which is item development, which is where we set the groundwork. We try to interview patients, understand their concerns, and also capture their perspectives as well as their healthcare providers. And then we was able to develop a set of questions based on these perspectives. The second phase was the scale development. This is where we refine the scale multiple times by, again, retesting these list of questions on healthcare providers and also a larger number of participants. After refining the questionnaire, we was able to develop a final draft of the questionnaire, which is simpler and more precise in capturing the symptoms profile and health change in CPA patient. The current phase we are currently ongoing is the scale evaluation. This is the most important phase on any health-related quality of life questionnaire, which aims to assess the reliability, the validity of the questionnaire, which means are we able to capture what we want to actually look for? Is the questionnaire sensitive to change? Is the questionnaire tend to cover, as I said, what is intended to cover? So the ongoing clinical study, phase 3, is ethically approved, aiming to measure changes in symptoms and quality of life. This is a multi-center study. Three specialized centers is involved in this study, which is Royal Brompton Hospital, Manchester University Hospital, and Tayside Hospital in Dundee. We are aiming for this phase to recruit 100 individuals with CPA. We're going to request them to electronically fill out the final version of the CPA questionnaire along with other health assessment tools to be able to compare its validity with the existed measures. This study per visit takes 5 to 10 minutes because it's electronical version. The study duration, however, involve a monthly involvement over a 6-month duration. So how you can get involved? As I said, involving in this clinical study is requiring you documenting your symptoms experience with CPA monthly. uh, and also your involvement will help shape the questionnaire to reflect the real life challenges, which is by the end we will be able to achieve our outcomes. This is just a pathway of the protocol involving in this study. After the patient consent on the first study, we capture demographic information as a baseline, and then we ask the patient to complete the questionnaire along the other validated questionnaire, either by online or on telephone if you are not able to use your telephone or the technology, or sometimes we are also able to post the questionnaire. So on Manchester site, we are not actually trying to get a sputum serology sampling. However, in Royal Brompton Hospital and Tayside, we also have an extra step, which is collecting sputum and serology sampling to be able to correlate the health-related quality of life outcomes with the known markers. And then from the baseline visit and onward, you only require to repeat the monthly visit, which is filling out the questionnaire. And that's all for me today. Thank you very much. Please feel free to ask any questions, share your thought, or participate in our study.
Which were the sort of the main points that you think were quite different between your tool and something like the St George's respiratory questionnaire? Was there anything in the St George's that just wasn't right or was missing?
That's actually a really important question. So one of the key symptoms that is featuring CPA, for example, hemoptysis or coughing up blood, which was not at all captured in St. George Respiratory Questionnaire, for example. On the contrast, St. George Respiratory Questionnaire would ask a question that is not related to CPA patient, which makes the experience of filling out the questionnaire just hindering, because the St. George Respiratory Questionnaire covers about 50 questions, where it's not all of them related to CPA patients, for example.
I mean, we've validated St. George's for our use
Yes.
About 15 years ago, but of course it's not specific. So although
Exactly.
it was very good at assessing the kind of overall, because of course people with CPA also have asthma or can do. But we were probably more or less assessing the underlying asthma rather than CPA itself. And this will help us actually judge whether treatments are working on aspergillosis itself.
Correct.